when it comes to infertility, how can it be treated, and what are some challenges that might be associated with diagnosing it?
Yeah, so first and foremost, it's so important to get a complete evaluation. You want to make sure that every component is assessed from the get-go so that you don't miss something and then go down a wrong treatment path. So what I mean is I usually describe it into four major factors. And so one could be a male factor component, meaning that you could look and do a semen analysis to check the sperm, see if the numbers are good, they swim well, and if everything's great, then you can check that off the list. However, if something comes back abnormal on a semen analysis, then that will key you into what kind of treatment could be helpful for infertility. This could be something like taking the sperm and injecting it into the uterus, which is called an insemination or IUI, versus men who have very low numbers of sperm. Sometimes you require doing more invasive treatment, which is called IVF or in vitro fertilization. So that semen analysis should never be skipped in any evaluation because it's so important in dictating how to treat infertility appropriately. Beyond that, the other tests are for the female. So the three other factors are related to the ovaries, okay, or your eggs, the tubes, the fallopian tubes, and the uterus. And so to check to see if the fallopian tubes are open, every woman should have an evaluation. And there's different tests that can be done. The most common test is called a hysterosalpingogram, or HSG, and it's called the dye test, and you can read about it online, but essentially it allows you to really get a glimpse into the uterus and into the fallopian tubes to see if the tubes are open, which would allow natural conception. If the fallopian tubes are blocked, then there's not a possibility for the egg and sperm to meet, and hence really you cannot conceive naturally or through something like insemination. You really have to do something like in vitro fertilization, where in the lab the egg and sperm meet, and that's how you create a baby. So that helps us determine if the tubes are open. And the HSG is also helpful in getting a sense of the uterus, making sure the uterine shape is normal. There's nothing inside the uterus, which we call it's the baby condo. It's where the baby will grow and develop. You want that environment to be normal, perfect, nothing that can impact its ability to grow. And so the HSG gives us that information. And then the last thing, as I said, is the ovarian factor. And so we want to make sure a woman has and is ovulating, releasing an egg every month. And so those are certain tests we can do. And we also want to gauge, what is a woman's fertility? Does she have an average number of eggs for her age? Is her egg number higher than expected, or is it actually lower than expected? And based off of that information, it really helps you determine what treatment is going to be best for someone. Because if somebody comes in and they say, well, look, my whole life I've wanted to have 3 kids. I'm 32. And then we do testing and we find out her egg number is like someone who's in her 40s. Well, then we have to act more quickly and to consider more, different kinds of treatments like IVF, because they may have a limited amount of time to conceive with their own eggs. So all of these workups and testing and, all of this thing is so critical at the beginning, because if you go through treatment and you skip to semen analysis only to find out there was no sperm, that's wasted time, that's wasted money. It's an emotional roller coaster. So you never want to do that. You always want to check everything ahead of the game, and then be able to, complete a nice treatment plan based off of all those test results.
Would you say that that's a challenge?
Yeah, I do think it's a challenge sometimes. It depends. There's some, male partners out there who really are not comfortable with doing, a semen analysis. It's not the favorite thing to say, go to this room and ejaculate, collect it in a cup, and, we're going to look at your sperm under a microscope. But to skip that is, really not the appropriate thing to do. And then it's sometimes a challenge because, we can talk all about it. Sometimes insurance covers this kind of testing, sometimes it doesn't. And when you do have to pay out of pocket to get some of this testing done, it can be a challenge to complete. And so sometimes evaluations are partial, some things are skipped, and then again, it has a downstream effect because it can affect the optimal treatment for later.